A new poll shows 73% of unvaccinated Americans believe officials are exaggerating the risk of the COVID Delta variant.
And 79% believe they have little to no risk of contracting it. Here to discuss, co-chair of the GOP Doctors Caucus, Congressman Brad Wenstrup. Good morning to you, Congressman. If you could put, I guess, your doctor's hat on for a moment, how concerned are you about this Delta variant?
Well, I'm concerned. It's not uncommon for viruses to try and survive as best they can. But the good news, I guess, as we're seeing this, is that those that have been vaccinated already for COVID-19 are doing pretty well when it comes to the Delta variant if they are to contract it. In other words, we're not seeing hospitalizations and deaths. But I am concerned about those that aren't getting vaccinated, especially in the more vulnerable communities. And so we want to see that continue. We've done public service announcements. We've tried to get it out there. I think some people look at the numbers and, yeah, they may have a smaller chance of getting it, but at the same time, they have a much better chance of survival and health if they have gotten the vaccine.
This administration hasn't really been strong in its push to try and, investigate the lab leak theory, get to the origins of COVID-19, at least not publicly anyway. They could be doing all of this behind closed doors, but publicly they haven't really come out as far as putting pressure on China, if you will, and holding them accountable. So with all of that in mind, how do you think this is going to play out in 2022? Because look, I think a lot of Americans at this point are frustrated by all of the lockdowns in some areas. Some restrictions are still in place. We've seen what that's done to the economy. We've seen what it's done to jobs, and now jobs that are open and people can't get workers. What does this mean for 2022?
Yeah, you touched on a lot of things. I think that employers especially are frustrated because they don't have employees because they've been paid to stay at home. But as far as pursuing the origin, I think it's hugely important. I served on our Board of Health in Cincinnati, Ohio, and we had nothing the size of COVID. But you've got to have the correct data, you've got to have honesty, and you've got to have transparency. Unfortunately, this gain-of-function research is accepted by many in the scientific community to be okay. Dr. Fauci in 2012 said that, well, doing this gain-of-function research, which makes the virus more infectious to humans, he said the benefits are worth the risk. I think a lot of people would disagree with that today, as we've seen what's happened, and the whole world has been affected by this. We're going to continue to investigate. I serve on the Intelligence Committee. We did an interim report about the origins of COVID, and all things are pointing to the lab. Not necessarily intentional, but to be in denial afterwards has been a real problem and allowed this to spread. Then we also have our task force, which has engaged with many of the scientists, and this is Republican only. And we had one of the scientists come from Berkeley, and he said he was given a hard time because he was going to talk to Republicans, and he said, I'll talk to Democrats as well. So I don't know why they want to bury their head in the sand on this predominantly. I will say that Facebook allows the conversation now, and we have our First Amendment right on Facebook again to discuss genetic engineering. So I think there's a lot of cover-up, and that doesn't help us if we don't get to the truth, especially for the future.
Really quickly here, Dr. Fauci says vaccinated people should now, again, he says they should wear masks in low vaccination areas. 10 seconds on this. Do you think that he's right on that?
Well, I think the masks have proven to be, they don't hurt anything. I don't know that they've always been significant. I'd like to see some science on it if he's saying that, but I think people should be cautious if this variant is in their area and they're subject to possibly getting it, just as a precaution.
All right, Congressman Brad Wenstrup with some great insight there. Thank you so much for joining us this morning. We appreciate your time.
Absolutely. Thank you so much, Congressman. Appreciate the information. All right.